Hello, my name's Helen Sanderson. I'm recording this webinar for Social Care Future, and it's about the outcome and support sequence, but specifically how to implement the outcome and support sequence in provider organisations. So for 4 years, I worked as part of wellbeing teams, and these are two of the wellbeing teams in Thurrock. And we implemented the outcome and support sequence when somebody joined our service. So when we did an initial conversation with somebody, when we were referred by a social worker, and also at the 6-month review. And we were delighted to be inspected and rated outstanding by CQC. And part of what they paid attention to was our paperwork, our outcomes, and how they were being delivered. So we're quite far away from January now, but I'd like to ask you to cast your mind back and think about one thing you'd like to change or achieve, an outcome in your own life over the next 12 months. Perhaps you did this as a New Year's resolution. And although we don't talk about New Year's resolutions as outcomes, those are the kind of things that we want to look at. And we know that you're much more likely to achieve an outcome if it's this specific and if it's rooted in what matters to you, who matters to you, where matters to you, and your aspirations, if that's appropriate. And if we're also paying attention to your strengths, assets, and qualities. So the first step in the outcome sequence is to really understand what matters to the person. Then it's about exploring what's working and not working now from the person's perspective and perhaps from other people's as well. And we move from that to the positive change that you want to see. So this could be changing what's not working or moving towards an aspiration. And we take that information and make it into a specific outcome. And finally, we check it. So can you measure it? Do we know the starting point? So if, like many people, your New Year's resolution or your outcome was to get fitter this year, how do you know if you're getting fitter? So it might be how far you can run now, and then how far you can run sometime in the future. Or it might be around losing weight. And if you wanted to lose weight, you'd want to take a baseline of what you weigh now and have an aspiration or an outcome for what you wanted to weigh in the future. So 2, is it achievable? We know that Couch to 5K is achievable, but if you wanted to run a marathon within a month and you haven't run before, that certainly wouldn't be achievable. So can we measure it? Do we know the starting point? Is it achievable? Does it keep or build on what's working, or does it change what's not working? So I used to be an occupational therapist really early on in my career, and we would focus on supporting people to become more independent. But we weren't very good a few decades ago at connecting it to what really mattered to the person. So it's crucial that the outcomes that we co-produce with people relate to building on what's working for them or changing what's not working. And even better, does it move us closer to the person's positive change or aspiration? And when it's related to an assessed need, we need to be double sure that that the outcome will be met from the assessed need. And then finally, in everyday language and not expressed from a service perspective, would your mum, your grandma, your friends understand how this was being described? And finally, although it might sound a bit strange, the outcome doesn't include a solution. So in wellbeing teams, we would get outcomes from social workers that said to give the person food 3 times a day. Well, that's a solution or a service prescription to an outcome around people being healthy and safe and maintaining good standards of nutrition. So in order to use the support sequence, you need to have clear outcomes, and that's why we put the 2 things together. And this is an overview of the support sequence. And the purpose of the support sequence is to generate ideas from a range of different ways of thinking about it that can enable the person to achieve their outcome. But before we start, we want to have a conversation with the person about what they've tried and learned already and what their ideas are. And then we look at the support sequence together to generate other ideas. So sometimes it might be an idea for achieving your outcome that's about building on your strengths and qualities, or you may need to improve some area of your knowledge or your skills or your confidence. It might be around technology. And traditionally, we think about technology in terms of keeping people safe, but actually, there's so much technology that's in your pocket in terms of apps that we could be using to enable people to achieve their outcome. So it's back to the OT in me. Is there equipment or adaptations that could help the person achieve their outcome, or any physical changes that need to be made to the home or the environment? Number 4, can family, friends, or neighbours help you achieve your outcome? Number 5, are there places, groups, or events happening in your community that could help? And of course, that includes online communities as well. And then services or settings. We intentionally designed and developed the outcome and support sequence to be appropriate for young people in school, young people in transition, and for adults and older adults. So for young people, what could your school or college do to help, and what's available in the local offer? And for adults, are there any general health or social services that can help, and what's available through universal services? And then finally, number 7, paid support. Could additional specialist support help, or could you organise support that could help either through an existing provider or through a personal budget? So let me share a few examples with you. This is Pat, who was Michelle's mum, and Michelle would share with us her learning and experience with her mum, Pat, that included developing outcomes. So if we start with developing outcomes from what's not working, Pat would say that she felt unsafe at home and scared of having to go into residential care. So that's what's not working for Pat. And then we looked at how to develop an outcome from what was not working and framed it like this. What's the positive change that we want to see happen for Pat? And it was for Pat to stay living safely in her own home. Now we wanted to make it even more specific. So we got to the detail of for Pat to stay living safely in her own home, surrounded by friends, family, and neighbours. So can we measure it? Can we get the detail of knowing whether that's working or not? And we can. There are 3 specific ways that we were looking at. How often Pat has visitors, her confidence, perhaps using a confidence scale in feeling safe at home, and potentially a reduction in hospital visits. Now meet this young man called Sam, and we built Sam's outcomes around his aspiration. So his aspiration was to earn money as a YouTube influencer. So we asked the question, if I could, I would, what would you want to do? And that's what Sam wanted to do. So developing that more into an outcome, what's the positive change that we'd want to see happen? And that would be Sam has a YouTube channel with followers. And if we're making it more specific and for something that we can deliver, it would be in 12 months' time, Sam is posting weekly content that he's interested in to his YouTube channel, and his YouTube data shows increased likes, shares, and followers. Can we measure that? Well, yes, we could look at the number of weekly posts that Sam's supported to do, his likes and whether they're increasing, and whether he's got an increase in his followers. So let me give a different kind of example around the support sequence. Let's imagine that you want to keep your house tidier and cleaner. And usually, if people want to do that and they can afford it, they go straight to the idea of having a paid cleaner. But yet, let's use the support sequence to develop some other options that you could consider. So yourself, how can you build on your strengths and qualities you already have? And what else could you do to improve your knowledge, skills, or confidence? So if this was me, well, I've heard of Marie Kondo, and I know that she's really brilliant at helping people declutter. And I've seen a couple of her programs on Netflix. So it may be that if I could learn to declutter and only have things in my house that I really love, that I could get better at keeping things in their place and it being tidy and clean. And I think there are YouTube influencers or WhatsApp influencers, Mrs. Hinch or someone, that recommend different cleaning products and show you how to clean. And I know there's a particular product called Purdy and Fig that a lot of my friends are getting excited about. So that might be something to explore as well. So I could improve my knowledge and skills around tidying up and declutter and perhaps even cleaning. Technology. Are there apps or technology that could help? Well, I could ask ChatGPT if there's any apps that could help, and technology too. But I already know that you can have a robot Hoover, and I know one of my friends got one. And actually, he has one for downstairs and upstairs, and he has them on a timer so they hoover when he's out. And I believe there's also a mop version of that. So there's definitely technology that could help that I could explore. Equipment and adaptations. Well, I know it's easier to clean floors if you don't have rugs and things around there. So I might want to make a few physical changes. And I wonder whether there's anything I could do with Alexa, although Alexa's technically in the technology side. There might be other things that I can do with other bits of equipment. Family, friends, and neighbours. Now, I'm a really keen gardener, and I may have some friends or family or neighbours who don't actually enjoy gardening but enjoy cleaning. And I could do an hour's swap with them, a bit like an informal Let's or informal time banking scheme. So that's something to explore. And community. I don't think there are anything to do with keeping your house clean in my community, but there might be online communities. And again, I could actually, I think there is one on Facebook for people who are doing decluttering. So I could do a better investigation about online communities. Services and settings, I don't think there are any there that would specifically relate to me around cleaning and tidying my house. But in terms of support, yes, I know I could pay for support with a cleaner if that was the only resort, the last resort for me. So that's a different kind of example that you might relate to some of that about how we can use the support sequence to generate ideas and then decide which one you want to take forward. And you might do that as experiments, or you might take 2 or 3 forward and then review it and see what else you want to do. So here are some of the things that can go wrong when you're developing outcomes. The first one is not being specific enough and it not being measurable. So a poor example would be just to improve my fitness and stamina, and I talked about this. Not being achievable, having something like Lucy will join a walking group and make 2 new friends. We can't determine whether people make friends or not, but we can support them to be with people and hopefully be with people who might share similar interests. Not linking the outcome to what matters to the person, using jargon or service speak, and embedding the solution or resource in the outcome. And here are some tips. So particularly when people don't use words to speak, or if their understanding is difficult or if talking is difficult, it does not exclude them from being able to do that. And there's some tips and hints there. So let me share a few examples with you. So this is from community circles and well-being teams. And Anne's outcome was to get out more and to gain confidence. So one of the things that we explored in the community section was to see if Anne could actually start her own community activity or community group and bring people together to help her get out more and improve her confidence. And what she did was care and craft days where she lived in her local community. This is Anne. We supported Anne in wellbeing teams in Wigan, and she had a massive difficulty with pain, had obviously gone through all the NHS possibilities and worked with a nurse around it. One of the things that we thought we'd try as well was technology around having a VR headset. Now, Anne absolutely loved elephants. She actually had a tattoo of an elephant, and she spent her time on safari with elephants through her VR headset, and that really enabled her to manage her pain in a completely different way. Shirley was often stressed and upset, and in wellbeing teams we had a lending library, not for books, but for different kind of technology. And part of that was a robot cat. So one of the things that we experimented with was to lend Shirley the robot cat to see if this could reduce her stress and anxiety levels. And she was delighted. And this is Dolly. Dolly used a wheelchair, as you can see, and was also really tech smart as well. But she wanted to go further and she wanted to strengthen her upper body to help with her wheelchair. So she used an iPad, and we found some exercise videos to help her do that. So another technology example. And this is a community example. So we set up a community knitters group, and we had several people who didn't see anybody else during the week other than people from wellbeing teams. And it was both boring and lonely. So we would support people like Winnie to spend time at the Knit and Natter, which was actually held there at Sam's Dry Bar. And it was a great opportunity for people to do something significant. We were actually knitting for a local hospital, as well as connecting with people and developing or improving skills. And this is one of the wellbeing workers who we worked with, who supported somebody who suddenly needed the support of two people, but wanted to keep this carer. And we had a conversation with the family and agreed that the daughter's son, would help support on a Sunday to offer the 2-to-1 support that she needed with the carers that she loved. One of the things that we do, particularly on training with people, and this was done in Greater Manchester for a cancer service, is to help people look at how we can use technology. So we do an exercise where people identify as many apps and different kinds of technology as they can, and then allocate it to different areas that people might be interested in developing their outcomes on. So this is an app wheel that was co-created in Manchester with people working in cancer services. So let's move on now to how you can make this happen in your organization, either in a provider organization or through commissioning or through the local authority or NHS. And one of the things, so obviously getting some training, but then looking at whether you can build internal capacity. So one possibility is to have champions and trainers available locally who can support teams to build and keep their knowledge and skills up to date, and do coaching sessions with them too, group coaching sessions, and also building the induction, at least a sort of half-hour introduction to the outcome and support sequence. This is the one that really, really makes a difference, which is training for managers. We need to support managers to know how to review care and support plans, or review plans that come from initial conversations if you're a provider. And we've got a checklist for supporting them to do that. In supervision, we use something called confirmation practices to help practitioners reflect on how well they're doing around the support sequence or the outcome sequence. And team meetings. Team 15 is a 15-minute exercise that you can do in teams to look at an issue that you can use the outcome or support sequence with, or to solve problems. Very often we send people on training and hope they've reached a level of competence. But I think in the outcome and support sequence, these skills need to be a requirement and not a nice to have. And we need to expect that practitioners and team leaders are able to demonstrate their competence, not just having attended training. And what makes a difference over time is having practice coaching sessions. So a group of people, so for example, we've worked with a group of social workers who come together at lunchtime on a Friday, bring their lunch, work with us on Zoom. One person brings a real situation that they're supporting somebody around. We go through their outcome and the support sequence, and everybody generates ideas. So it actually is a practical help to the person, as well as practicing what kind of ideas we could come up with in the support sequence. So here's some of the resources that you can use. So this is a practitioner's self-reflection. So let's imagine you've developed a care and support planning with an individual who's on your caseload, or as a provider, you've had an initial conversation with somebody and you're looking at their outcomes. So here's a series of questions, 5 questions, and a checklist to use after planning, or you could use it with your peers or your managers. Confirmation practices is simply about giving yourself a score. It's a reflective practice. So if you were doing this, for example, with a social worker in their one-to-one, you might spend 10 or 15 minutes asking the person to score themselves between 1 and 5 around these statements. So I'm confident in it that I'm capturing the strengths, assets, and skills about the person and with them, or I'm confident that in sharing the ideas with the person, I'm supporting them to decide which ones they want to take forward. Score to 1 to 5, and then the manager can coach them. It's a really simple process. You do not need a coaching qualification to do this. There are a series of questions that supports them to take their lowest score or the one they're concerned about and help them set an action for how they can improve. And we've got it both for the outcome sequence and the support sequence. And managers, you could choose an anonymous plan and use this checklist to review it in relation to outcome sequence statements and the solutions and actions to achieve each outcome, and then see what you notice. And you may then give the person who's developed the plan feedback on what you've noticed that's great and how they might be able to improve. And it's really important to get a sort of litmus test or a review on what's going on with care and support plans in particular. For example, do some colleagues, some practitioners never look at technology? And if that's the case, you really want to explore why and what you can do to support them in their confidence and competence in introducing technology as part of the support sequence. Or you might find some people going directly for paid services all the time. And again, that's something to look at. And also, you'll see some people doing great work and finding innovative community solutions. And those are things that would be amazing and great to share with the rest of the team. So again, in one-to-ones or supervision, here's a checklist that you can use in supervision to help reflect with the practitioner on how they're doing and giving them feedback on using the outcome and support sequence. And team 15s. So again, just spending 15 minutes in a team meeting and perhaps using a card like this or a real scenario. So what if the person doesn't agree with an outcome related to their health and safety? And if you've got 8 people in the team, go around and ask each person without judgment what they would suggest, and then have a conversation together as a team and saying, what do we think the best way of addressing this? What do we want to do? So lots and lots of scenarios like this that you can use in team meetings to help people keep developing their confidence and their expertise around the outcome and support sequence. And finally, we've created an induction resource that takes about half an hour that supports people to think about the outcome and the support sequence for their own life, to then build on that and look at it with a manager or more in depth in induction, so that right from the beginning of their journey with an organization or a local authority, they recognize and are supported that this is the way we want people to work. So thank you very much for paying attention to this and to listening to it. Please come and find me on LinkedIn, where myself and my colleagues are regularly posting about the outcome and support sequence. We have a newsletter that's specifically about the outcomes and support sequence with new resources that we share, or come and find me on Helen at helensandersonassociates.co.uk. Thank you.